We're going to be talking about what is PHI under HIPAA and when PHI is not PHI. So let's start with what is PHI under HIPAA? In a healthcare environment, you hear health information referred to as protected health information for PHI. What some medical practices get confused with is what exactly is considered PHI under HIPAA rules. Under HIPAA, PHI is any identifiable health information that is used, maintained, stored, or transmitted by a health provider, health plan, health insurer, or a healthcare clearinghouse. That includes any business associates of HIPAA-covered entities. That also includes any transactions in the healthcare of the patient as well as billing of the patient. PHI is health information in any form, including physical records, electronic records, or spoken information. It's not only past and current health information that is considered PHI under PHI rules, but also future information about medical conditions or physical and mental health related to the provision of care or payment of care. Therefore, PHI includes health records, health histories, lab test results, and medical bills. Essentially, all health information is considered PHI, but includes individual identifiers. Demographic information is also considered PHI, as are common identifiers such as patients' names, social security numbers, driver's license numbers, insurance details, and birth dates, and where they're linked with health information. The 18 identifiers that make health information PHI are names, dates except year, telephone numbers, geographic data, fax numbers, social security numbers, email addresses, medical record numbers, account numbers, health plan beneficiary numbers, certificate license number, vehicle identifiers and serial numbers including license plates, web URLs, device identifiers and serial numbers, internet protocol addresses, full face photos and comparable images, biometric identifier, example, retinal scans, or any unique identifying number or code. One or more of these identifiers turns health information to PHI, and PHI HIPAA privacy rule restrictions will then apply, which limit uses and disclosure of this information. HIPAA covered entities and their business associates will also need to ensure appropriate technical, physical, and administrative safeguards are implemented to ensure that confidentiality, integrity, and availability of PHI as stipulated in the HIPAA security rule. When is PHI not PHI? Here are some of the exceptions. First, it depends on who records the information. A good example would be health trackers. Either physical devices worn on the body or apps on mobile devices. These devices can record health information such as heart rate or blood pressure, which would be considered PHI under HIPAA rules if the information was recorded by a healthcare provider or is used by a health plan. However, HIPAA only applies to HIPAA-covered entities and their business associates. So if the device manufacturer app developer has not been contracted by a HIPAA-covered entity or his business associate, the information recorded would not be considered PHI or under HIPAA. The same applies to education or employment records. A hospital may hold data on its employees, which can be included in some HIPAA health information, allergies or blood types, for instance, but HIPAA does not apply to employment records and neither education records. Under HIPAA, PHI ceases to be PHI if it's stripped of all its identifiers that can tie the information to an individual. If the above identifiers are removed from the health information and referred to as de-identified PHI, for de-identified PHI, HIPAA rules no longer apply. Hopefully this helps in identifying what is PHI under HIPAA and when PHI is not PHI. As always, if any questions, reach out to Trinit and we'll find the answer you need. Thank you.